Thank you everybody for joining us this evening. And I would like to thank Alaska Neurology, Dr. Brenda Roche, and also Sanofi Genzyme for the food and the space. This is Dr. Brenda Roche.
Excellent, thank you. So besides being Dr. Brenda Roche, you can just call me Brenda, I'm also cousins to Shelley and Tina. And I was actually diagnosed with MS in 1999, in August of 1999, but really had had symptoms, I don't think this will be a surprise to anyone here, for 10 years prior, just not getting diagnosed along the way. And so I am a neuropsychologist. I live in Billings, Montana, and practice there. I'm mainly seeing pediatrics, but I do see some adults, but mainly the pediatric population. And so this is my third year of coming up for the MS walk up here. So I'm excited to be here, and I thank you for the opportunity. Shelley and Tina asked me if I could talk a little bit about mindfulness with you all. So I also do clinical practice and do therapy with a lot of individuals as well. And mindfulness is one of the techniques that I really use a lot because it just is so effective. And so I'm pretty informal as well, so if you have questions, just blurt them out, raise your hand, whatever you want to do, that would be great. And we'll be making it interactive kind of at the end as well. So I won't make you do, really crazy things or anything like that. But so when we talk about mindfulness and what is mindfulness? And it really is, there's a lot of different definitions for it. But it really is just a different way of staying in the present. So it's a way of how we can kind of be in the present, not thinking about the future, worrying about the future. Another word for that is anxiety, but it's staying in the future, in the present, not thinking about the future, not worrying about our past, but really trying to figure out how we can stay, current and within the experience we are right now. And it really is being aware of not only what our body's feeling like, but also our thoughts and our emotions, as well as just being aware of our environment. So being attuned to, all of our different senses. So, what do we see? What do we taste? What do we feel? What do we hear? So all of our different senses, and just being able to be present with those in the moment as well. And so one of the things also that really is important is that when we stay mindful, that we do so without judgment, because oftentimes we'll judge different things as good or bad. And so it's really trying to just label it as what it is and taking away any judgment. So if we have discomfort or we have pain, we label it I have pain, but that doesn't mean it's good or bad, it just is what it is. And so it's really learning how to not allow it to control you, because oftentimes what happens and what causes us most distress is when it's our secondary emotion to the pain. So it's our worrying about, are we getting worse, or what's going on, or this is a different pain. And so it's the secondary emotion to the things we experience that most of the time cause us the most difficulty in our lives and the most distress. So it really is figuring out how to just stay present, label it as what it is without judging it good or bad, and so that we can just really kind of stay right in the present as well. Because most of the time we live our lives pretty mindlessly. We just kind of go about flittering around and without really thinking about what's actually happening in our lives right now, or we're thinking about the past, or we're thinking about what's going to happen next. Think about your day to day even, and what maybe if you were doing a task and what you were thinking about. Were you really thinking about the task, or were you thinking about what you were going to be doing tonight, or what's going to happen this weekend, or what you didn't get done today? Think about when you brush your teeth. How many of you just brush your teeth and focus just on brushing your teeth? Good job, excellent. How many of you think about what the water's like in your mouth and what it feels like and what the toothpaste tastes like and what the brushes feel like in your mouth? Excellent. Because it really is, it's a great way to practice mindfulness, but we don't do that. We're thinking about all of the other things in our life that's going on and what we're gonna have to do that day and what we didn't get done yesterday and all those things. And that just causes a lot of extra anxiety and stress in our lives. So it's really figuring out how we can do the things that we do in the moment and really staying present. And so that's really kind of the key to mindfulness. And to be honest, mindfulness isn't something very easy to do. You do have to practice it and practice it pretty regularly in order to get really good at it. But if you can get good at it, it really will make a huge, huge difference in your life. And so when we think about that, there's a lot of research out there, especially in the recent years, that talks about effectiveness of using mindfulness practice. And mindfulness has been considered to be helpful for improving things like depression and anxiety, high levels of stress and de-stress. Mindfulness can be helpful to people who have had, really traumatic events happen in their lives, so past trauma. So I work with a lot of individuals with a lot of trauma, and so we use a lot of mindfulness with them as well so that they can stay grounded and stay in the present when they're triggered for different things. And then when we look at about MS, has there been any research done on mindfulness and MS? And there has been. There's actually been a lot of research done around how to use mindfulness for people with MS. And what we do know is also that there's some great research out there showing that chronic exposure to stress there's an association. It's not causal, but there's an association between worsening of neurological conditions and actually increased brain lesions when we have high levels of stress. So would that indicate to all of us in this room that there's a reason to decrease our stress? Yes. If we want to control our disease better, we want to do the best we can to keep our stress down. There's also a correlation between high levels of distress and stressful events and relapses with MS as well. So again, looking at how can we decrease some of that stress. And mindfulness is one thing. There's a lot of other things that we can do, but mindfulness is one technique that you can use to really help decrease the stress that you're experiencing. And researchers really believe that mindfulness may help people better respond to stress by fostering basically better and healthier coping skills. For example, there was a study that participants who reported higher levels of mindfulness were less likely to use ineffective coping skills such as denial or disengagement, self-blame. And they tended to use more positive coping mechanisms such as information gathering, finding out information, learning about all of the different things that are going on, planning and seeking out that social support. So we do know that it really can be very helpful to use that mindfulness to decrease our stress. And these days, probably more than ever before, we really can easily kind of get caught up again in just doing things throughout the day and fail to be really present with where we're at currently. And that can be, it doesn't matter whether we're working, we're at home, we're alone, we're with others, we're studying, we're traveling. Just so many of us are missing kind of that beauty of life and being present. And the problem with that is we also then miss the positive things that are going on and the really exciting things, because we're missing life in general, because we're always worrying about what's going on or thinking about the past and all that. And something really positive can happen during the day and we just miss it because we're not present with it. And so not only are we, not being able to present and deal with the negative things that might be happening in our life, but we miss all the positive things that are going on in our life as well by just not being very mindful. Having said that, what's really important to remember though is mindfulness is not a way to get rid of events, memories or feelings associated kind of with past experiences. So it's not going to get rid of those things, but what it does help us is it helps us have less suffering because of those events. So one of the things that there's a lot of research out there showing too is that when we have an event that's happened in our life, whether it's our MS diagnoses or we're having an exacerbation, whatever, we attach an emotion to that. And so then that emotion controls us and it really hijacks our brain. And so it puts us into fight, flight, or freeze part of our brain, and we react on that emotion. And if we can separate the emotion from the event, then it just becomes another event, like brushing your teeth. And so, because we don't have the emotion, it's the emotion that's attached to it again that's causing us the distress. It's not necessarily always the event. And so it really is important to be able to separate those two. It doesn't take away the fact that it's occurring, but it just helps us take the distress and the stress away from that particular event. I don't know about you, but I know when I was diagnosed with MS, I was going into my last year of graduate school. So I was just starting my career, had no idea, had nobody in my family I didn't know anybody with MS at that point. And so I was pretty stressed out about what was going to happen in my life. Was my career over before I even started? What was I going to be like, because you always hear all the worst that could happen. And so that's really common when, with people that are diagnosed with MS, is that there's, a period of depression and readjusting and thinking how my life's going to be different, how's my life going to change, all of those things. And so when we look at how do we use mindfulness, especially in the early stages of being diagnosed or as our disease transitions into, different symptoms, it really is important and can be very helpful to use it. Thankfully, I had been trained in mindfulness at that time, so I was using, a lot of those skills at that time. And when I actually went in for the diagnoses, I had done a lot of research thinking about all the things it could have been. And when my neurologist told me at that point, it's MS, I went, yes. And he kind of looked at me a little strange, like, are you okay? And I'm like, yeah, because I can live with this. I can live with this. I can figure out how to manage it. And, I can still have my career, because the other diseases that I was looking at, that wasn't the case. And so it really is, it's again, in a mindset and how we look at things and how we interpret it and the emotion we attach to it can really make a big difference. And so it really is a meditative technique that's used, and it involves learning to just focus, again, attention on the current and the present, on your emotions, on the sensations and thoughts, and again, in a non-judgmental way, by focusing really fully on the present rather than the regrets of the past and worries about the future. It is, it's an established therapy that we use, but it's considered a complementary or alternative therapy. I would never suggest use mindfulness and stop taking our disease-fighting medications, because don't do that. It's not for that purpose. It really is to help us handle our mindset and to help that stress level that we have because of our disease. Studies have shown in MS that mindfulness can improve the quality of life and help people cope better with their MS. And various studies have found in regards to MS that mindfulness can help decrease pain, stress, anxiety, and depression, and also help with better sleep. And so how many of you would like those things to happen, right? Yeah, I know. And mindfulness is actually recommended by the National Institute of Health and Care Excellence as a way to prevent depression in people, especially if they've had 3 or more bouts in their life. So there's been a lot of great research out there on mindfulness. And when we focus, the other thing is oftentimes, I think, when we, at least in the beginning when I first started being treated for MS, a lot of it was just about the physical part of my body and taking care of the physical part and taking the medications and doing those things. No one really talked to me about the mental health piece. No one talked to me about mindfulness. No one talked to me about, where my mental health kind of was at that point in time. And so I think it's really important for us to really look at that and look at, we have both physical and mental health, and how do we combine both of those in order to take better care of ourselves. And so there's been, research suggests that at least half of the people with MS will experience some mental health symptoms at some point after they've been diagnosed. And most commonly, it's depression or anxiety related to that. And people with family histories of depression or anxiety are at more risk of having that as well, especially if we then also have the MS that comes along with that. And so one of the things is, what do we do about this, right? So if we look at that, so the first step is to really just realize in your mind that our mind requires care the same way as our body does. We have to take care of our mind just as much as we take care of our body. And so really looking at it in that way. And so the first step is to just learn what you can do to practice mindfulness and really be aware of it. So some of the things are, there's 5 different things, and I'm going to give this stuff to Tina so that she can kind of get it out to whoever so that you can have it as well. But the first one is managing your thoughts. Everyone experienced thoughts, that are unhelpful. How many of you had an unhelpful thought today? I know I did, right? We all have those. But the difference is, can you catch it when you have it, and can you change it? So you have to first recognize that it's a negative self-talk, and then you can change it in that way. And so you can do that by, one of the things we talk about is, imagine that your thoughts are being played on an imaginary iPod. These days we can use an iPod, iPad, whatever. And become aware of how much time you're actually listening to that imaginary iPod, and how often it's playing unhelpful themes or songs to you. Because I know for me, there's times in my life that I would not have been friends with someone if they talked to me the way I talked to myself. And so being aware of those thoughts and what we say to ourselves is really, really important. So, are you playing the same tune over and over and over in your head, and can you change it? And what would you do if you had an iPod in your ear, you were listening to a song on the iPod and you didn't like the song? You would change the song, right? Or you would take out the earbud out of your ear so you didn't have to listen to it. We can do the same thing with our thoughts. We can change that thought. So one of the things that you can practice is just really noticing that what you're listening, when you're listening to your unhelpful thoughts. And then imagine, again, taking that earbud out of your ear and changing what song you're listening to. So seems very simple, but you really have to practice it, because I think we go along a lot in life being just very unaware of what we actually say to ourselves. The next one is just to learn to live in the now and and spend less time in the present or the past and the future. less time in our head. Research shows that staying in the present moment, again, helps with mental health. So it really is, not regretting so much of the past or worrying about the future, but really staying in the present. So a way to do this is just to take a moment to focus on what is happening in the here and now. What you smell, what you see, are you hot, are you cold, are you tense, are you relaxed, what are your muscles feeling like? And so it's really being aware of all those senses and really practicing that. And you might only be able to do that for 5 seconds when you begin. You might be able to do it for 30 seconds. You might be able to do it, you can just build up. You can't fail at it, because 30 seconds is more than what you were doing before. And you can just build up. And what do we tend to do if we're practicing a skill like this and we find our mind wandering? What do we tend to do? Anybody? Chase the squirrels, or we judge ourselves. See, I can't do this. I'm never going to be able to do this. We start judging ourselves. And then we judge our judging. And so it's like, just recognize that, okay, just acknowledge what happened. You identify, oh, my mind just wandered. I'm going to bring it back. There's no judgment to that. That's not failing or succeeding. You just acknowledge that that's what's going on because you're aware that that's what's just happened, and then you just bring your mind back instead of doing all this judging. And then we judge our judging, and it just goes in this really vicious cycle, and then we just give up. And we go back to all of the same old ways that we were doing before. The other one that's really can be helpful, I've been doing this a lot lately especially, is keeping a gratitude diary or a journal. We just really oftentimes focus so much on the negatives that are going on, and we miss out on those positives. And so really it is at the end of each day writing down 5 things that have gone well for you, which you're really just grateful for, My simplest one is I wake up every day and I have a breath and I'm here. I have one more day that I can do something with, and I get to choose what I do with that day. So really looking at that and keeping track of that. Research has been very clear, if we do that and we start looking at the positives in our lives really can change. And then treating yourself with compassion, because we're our worst enemies and we're our biggest critic. And so looking at how we can give ourselves grace and being aware, again, of what you say to yourself and just being more nice. Don't be a bully to yourself. We are oftentimes very much a self-bully. And then thinking about food, mood, and exercise. What are we putting into our body? Is it healthy? Is it nutritional? Not trying to just put, trying to cut out all carbs or all protein or whatever. Eating balanced, eating a healthy meal. What exercise are we getting in there? And that doesn't have to be, huge amounts of exercise. Just a small, regular amount of exercise has been shown to have significant difference in our nutrition that we put into our body is huge in regards to how we feel, what our mood is like, and the energy level that we have. And so one of the things, this is a great deck of cards. It's my best deck of cards I have. Here it is. So it's called Growing Mindfulness Practices for All Ages. And so I would recommend everyone to get this, because we're going to do an activity right now with this. Is I'm going to have you, it's 52 cards. It just has one mindfulness exercise on each of them. And so what I do, and I've done this for years because I have about 5 decks of these, so I have them all over the place because I forget them. And so no judgment on that, I just forget them. It's not good or bad, I just buy more cards, decks of cards, and that takes care of it. And so what you do is you just pick one card. I'm going to have you pick, so I do is I pick one card and I just practice that skill all week. So it's my practice for the week. So then I gain a new mindfulness skill every week because there's 52 cards, 52 weeks, weeks in a year. And so because you want to practice it until you get good at it. And you want to find out, is this one good for you? What's good for me, that works for me, may not work for you. And so it's important as you go through to decide, is this one that's helpful for me or not? So Tina is going to pass these out. And I just want you to grab one. And this is the one that you're going to, I want you to read it out loud. We'll kind of go around so everyone hears each of them. And then I want you, if you're willing to, I can't make you, to commit to practicing it for the next week and seeing what difference that makes. So it's just a different card, it has a different mindfulness. They're really simple. Mindfulness does not have to be complicated. It can be really simple things that you can do. And then the other thing that I'm going to give Tina is I have, not today, later, is some real specific things like walking mindfulness. So things you can do while you're walking, that's an exercise to really be mindful. Mindfulness of thoughts, mindfulness of physical discomfort, and then also one of painful thoughts that you all can have and practice as well. So we'll start right here. If you don't mind reading yours out loud for us.
How do you know? Are you breathing? How do you know? Sound, sensations at different parts of your body. Rest your attention there for the next few breaths.
So that one's a breathing one, so it's a real simple one that just goes through that you really start, because how many of us are really aware of our breathing? And unfortunately, most of us, when we do breathing, we do very shallow breathing. So when you breathe, you should actually be, when you breathe in, your stomach should come out, and when you breathe back in, it should go back in, so it should look like this. But most of us do it the opposite direction. That's why we don't get enough oxygen in our brain. And so it really is important to kind of practice. And if you have a hard time with that, lay on your back, put a ball or something on your belly, and breathe in. And when you're breathing in, your stomach should come out. And you'll find that it takes a little bit of practice if you're not used to doing belly breathing. But it really is important. Breathing can make huge, huge difference, just getting oxygen to our brain. So excellent. Thank you for reading that. Yours.
Slowing down. Soften your face. Lower your shoulders and gaze. Open your chest and belly with the breath that you were talking about earlier. And wilt your fingers. In other words, don't be like that.
Yeah, don't get all like that, right? So is that something you feel like you could practice each day for a week? Yeah. And it's just taking the time. It doesn't have to take a lot of time in our life to do it either, which is really nice. You wanna read yours?
Mine's the tree. Stand tall with the confidence of a huge tree. Breathing in, I see myself as a tree. Breathing out, I feel confident and strong. Repeat for 5 breaths.
Excellent. So again, really simple things. They're great. Laverne?
Color by number. Look out the window and notice what is alive. Find and count each shade of green in your field of vision. It's interesting because green is my favorite color.
Well, there you go. That was meant for you.
And then I was looking around, look out the window, and I see all kinds of green.
Yes.
And in my new office, I have a window, so this will be interesting.
Excellent.
I can do this.
Perfect. Excellent. Tina?
Kind wishes. Make a kind wish for someone you care about, one for yourself, one for someone you really don't know, and one for someone who bothers you.
Excellent. So again, there can be a lot of different ways of thinking. So that's more around thoughts and changing our thoughts versus other ones are changing kind of more that we do physically as well. You want to read yours?
Stand or sit upright and take a deep breath into your belly. On the exhale, hum your breath out as loudly as possible. Repeat until you feel the vibration through your whole head and body.
Excellent. Perfect. Excellent.
When is my mind? Take 1 minute and count on your hands how many times your mind goes to the past, to the future, or somewhere else. Then return to the present for a rest.
Excellent. So again, that's getting at thoughts. Perfect.
Okay, sounds around. Notice 5 sounds around you right now. Count them on your fingers. Well, I have a ringing in my ears.
That would be one.
I hear the trickle of our chip bags.
Mm-hmm.
I'm not sure whether I hear the lights or these lights. You know, sometimes.
You can hear them.
Yeah.
Yeah.
I don't know. I hear silence. There must be about 5. I don't count them.
Yeah. Yeah, but it's really being aware because how often, again, are we just being aware of what's in our environment and, just the noises and just being able to just take that time for ourselves just to be calm with ourselves. Makes a big difference. Excellent. Thank you. Shelley.
Inhale deeply into your belly. On the out-breath, sigh as quietly and slowly as possible until all the air is released. Repeat.
Yeah. So again, a lot of breathing stuff because breathing is really a very common one that we do within mindfulness, and it's a really great exercise because it just helps get that oxygen to our brain as well. But as you can tell, hers was doing it loudly, yours was doing it silently, and so because we want to have skills that we can do in a lot of different environments. We're not going to start humming really loudly when we're sitting in the middle of a meeting, right? But we could do Shelley's where we're doing it silently. So it's getting basically a lot of tools in your tool chest so that no matter where you're at or what situation you're in, you have some mindfulness thing that you can go to and use. And that's really the goal. Go ahead. Excellent, perfect.
Mine says, Samurai's eyes. Study the scene around you and try to memorize what everything looks like. Close your eyes and visualize the scene in your mind's eye. Open them again. How close were you?
Yeah, that's a fun one. I love that. That's one of my favorite to do. It really is fun. Excellent, thank you.
Mine's the best one.
You got the blank one. Yes. I was wondering if someone was going to get the blank one. And what do you think a blank card means? Yeah, just clear your mind. It's just sitting there and not, it's just being just present with you and not, thinking about and just being present and, just experiencing what you experience. So excellent.
I got soft rain, R-A-I-N, so the R is recognize what you're feeling, A is allow or ask it to stay for a moment, I is investigate how it feels, and then N is see that it's not personal.
Perfect. Excellent. And the last one.
I got tense and release. Slowly tense and release all of your muscles from your head down to your toes. Feel what happens to your body and your mind as you do.
Yeah, and there's great research on that one, so it's kind of progressive muscle relaxation as well, that if people do that even just 5 minutes a day, that their anxiety level, that people have been able to actually go off anxiety medication because it just readjusts their brain, and so it's pretty amazing. So I hope you enjoyed that, but it really is, I would encourage all of you to get these because it doesn't cost, they're very cheap. And it just is a fun activity that you can do, and you can just pick a different one each week, and just practice that so that you'll just have a whole tool chest of different skills that you can use throughout the day to just, again, be more mindful and help you with that stress level, which will help with your symptoms of MS and just life in general. So, yes.
Where do you get those cards?
You can just order them online. They're from Pessy Publishing and Media.
Well, we just looked them up and they don't have them on Amazon. They're like $90 there, but they do have them at Barnes & Noble.
Oh, they do have them at Barnes & Noble? Excellent. So,
Now, whether they have them here.
yeah. So I was actually going to be leaving this set for Tina when I'm done here so that you can, if people want to check them out, whatever, then people can do that as well, or they can just, yeah, you could put it, or you could put it on Facebook, what it is for the week, and everyone could be doing them together, as well. So, so that will be my gift to you all up here in Alaska, as a deck of the cards. So, well, I hope you found this helpful, and if you have any questions, I'd be glad to answer those. Otherwise, we can just enjoy the rest of the time together.
Do you know of any apps that have something like that?
There
'Cause I have
are.
a friend that has an app where she has to go in and put three things that she's grateful for,
Yes.
whatever a day, and she hasn't responded, so I don't know what it is.
There are some great apps. I'll get those to Tina as well, and then if you could get that, because it might be one that I'm not aware of too, once you find out. But yeah, there's some great apps on the phone that you can use. There is so much out there on mindfulness to do, because it really is something that's, it's gone through a lot of really, in the last 10 years, there's just been a lot of research being done on it. So it's pretty exciting, because it's something that's pretty, we can all do it, and we can do it with kids, and we can do it at any time. And so it really is, and it's not another pill that we have to put, in our body. So excellent. All right, well,
I don't use
yeah.
it so much for my MS, but
Uh-huh.
I've been able to control blood pressure considerably.
Yes, yeah. I actually got to a point that I could decrease my blood pressure by 10 points by just doing mindfulness and calm. It's pretty amazing on how you can just really just adjust your whole body. Yeah. Perfect.
These are great tools for those of us that will be on the walk tomorrow.
Yes, indeed. We can do a lot of mindfulness stuff. Yeah, excellent.